Okay, and action! Welcome to Dermal Talk. My name's Melissa.
And I'm Maria.
And we are Bachelor Qualified Dermal Clinicians.
We've pretty much put together this channel to explain, to teach, and to bring awareness of dermal clinicians in the beauty but also in the medical industry.
We're creating this channel to share with you our passion for dermal therapies. So you'll be seeing us review products, talk about the industry, talk about treatments as well.
These are all of our own opinions. We're not going to hold a biased side. We're not going to be led by particular companies of our own personal opinion. We will make comparisons to what people think that may be good for their skin, or whether it is actually harming individuals. We'll be working with delivery systems and explaining them to you so that you know what you're actually getting with the products that you're using.
A lot of people ask what dermal clinicians are, and basically we've undergone a 4-year qualification in Bachelor of Health Science in Dermal Therapies. What that allows us is to specialize in non-surgical treatments, cosmetic treatments in particular.
Traditional beauty has changed dramatically, and clinical treatments that are performed by dermal clinicians tend to be a lot more mainstream now. So gone are the days where we used to treat dry skin, oily skin, or sensitive skin. Now we're actually trying to treat the condition, the skin health and the integrity of it, rather than what's only coming up on superficial level. I guess what got me involved in dermal, or wanting to study the Bachelor of Health Science in Dermal Therapies, is I started off doing beauty, and I kind of felt like I wanted a little bit more of a challenge. Not only a challenge in the type of treatments, but I wanted to understand why and how particular things within the skin occurred, what can be done to help them, to help reduce them, what were the long-term benefits in it. And I guess what I've been able to understand more so that a lot of people don't tend to think is that you have an acute or a chronic condition, and often when people come in with a chronic condition, they expect it to be fixed overnight, and they don't often understand that chronic diseases or conditions tend to occur over a long duration of time, and they go through different stages. And when you are going to a beauty therapist or a beautician, which we'll probably touch upon later on, is that they don't have that type of understanding, and you can't help people in the way to the same level and understanding as you would as a dermal clinician.
I suffered from acne, and I saw a dermatologist who prescribed me Roaccutane. There wasn't really much, knowledge of skin at the time. I didn't really know what I was doing to my skin, and I didn't have any advice from anyone either. After high school, I applied for a Bachelor of Health Science in Dermal Therapies. I got accepted, and I had to do the prerequisite, which was 1-year diploma of beauty therapy. Once I had finished that, I went on to 3 years full-time in the Bachelor of Health Science in Dermal Therapies. Dermal clinicians, we have taken that next step, have got the bachelor, and do have a lot of anatomy, biology, physiology included in our course as well, and that kind of is something that separates us from beauty therapists. You'll tend to find, if it is a salon, that they'll be doing massage, facials, nail treatments, whereas dermal clinicians you often find in clinical or med-spa settings, where we focus more on our lasers, our electrotherapies,
chemical peels, collagen induction therapy, or resurfacing or skin needling treatments. I guess it is. I'm often, when I deal with clients, I often get faced with the whole question, this must be really fun being a beautician and doing this type of work.
No, we're not beauticians.
Yeah, I'll definitely say a big no to that one. Beauty therapy or a diploma can be from a year to 18 months. Whereas when you're looking at the bachelor's degree, you're looking at a minimum of 3 years. then obviously progressing onwards. The main difference between that is we're not allowed to prescribe medication. So we don't have that general practitioner's understanding or that medical liability to say, here, take this medication, take this pill. So we tend to focus more on topical agents to help balance the skin, but also working a little bit with your internal health as well. I hope you liked our little introduction behind Dermal Clinicians. Hopefully it's been able to give you a little bit of an insight about what the word or what the profession is within the industry and where it sits amongst everyone else. So comment down below, let us know what you're interested in, and we'll see how we can help you at the very best of our abilities. We shall see you next week.
Bye.
Bye.